Good morning, all, and welcome to our inaugural policy webinar. On behalf of myself and all of my colleagues at the Commons Project Foundation, I want to thank our panelists and our audience for taking time from your busy schedules to join us today. And for all of the Muslim colleagues on the call, I wish you all Eid al-Fitr Mubarak. My name is Khadija Rejto. I am the Global Head of Policy, Government, and External Affairs here at TCP. First, I would like to briefly introduce the Commons Project to those in the audience that are unfamiliar with our organization. The Commons Project is a nonprofit public sector established with support from the Rockefeller Foundation. Its purpose is to build and sustain digital public services in a way that serves people's interests above all. Beginning with health information, we are focused on empowering people to access and control their personal data so that they can put it to use for their own benefit. As you have gleaned from the invitation you received, our gathering today really aims to discuss, albeit briefly, the dichotomy the world has found itself in. Containment measures such as border closures, which in many cases were absolutely necessary to tackle the spread of the virus, have naturally also choked economies and affected livelihoods in ways none of us could have ever imagined. In fact, according to the OECD, we are still living through the most serious economic crisis the world has witnessed since World War II. With us today to discuss these policy responses and their impacts, as well as opportunities that exist where success is possible, is a distinguished and diverse panel. I ask my colleagues on the panel to forgive me as I rush through truncated versions of your bios in the interest of time. With us today, Professor Miriam Altman. Dr. Altman is currently the Director of Altman Advisory and a Professor of 4IR Practice at the University of Johannesburg in South Africa. She also convenes the COVID-19 Economists Group. Miriam served 2 terms as a commissioner in the National Planning Commission in the South African presidency from 2010 to 2021. In the NPC's 2nd term, she led its work on the economy, infrastructure, employment, and education. For a decade prior to that, she was an executive director at the Human Sciences Research Council. She's currently leading the development of the South African government's National Infrastructure Plan for 2045. Also worth mentioning is that as head of strategy at Telkom, publicly listed state-owned company, Miriam was responsible for crafting and orchestrating its turnaround and continues to be deeply engaged in digital transformation. Also with us today is Stephen Cotton. Stephen is the General Secretary of the International Transport Workers Federation, also known as ITF, a global union federation of 665 trade unions representing 20 million workers in 147 countries in the seafaring, port, road, rail, and tourism sectors. He was re-elected to the position as the 44th ITF Congress held in Singapore in 2018. Under Stephen's leadership as General Secretary, the ITF has transformed into a proactive campaigning organization, allowing ITF and its affiliates to secure industry-leading contracts and protocols with key multinational companies. He oversaw major flags of convenience, which is a policy changes that led the introduction of Oslo to Delhi and Mexico City policies, which laid the foundation for the landmark 2006 signing of the International Labor Organization's Maritime Labor Convention, established a set of international minimum standards enforceable by international law. In 2014, Stephen received the United Seamen's Service Admiral of the Ocean Sea Award, the maritime industry's most prestigious award in recognition of his work for defending the well-being and fair treatment of seafarers around the world. With us also is Daniel Schwartz, the CEO of Dynamica, Inc., a philanthropic foundation and multi-office organization. Daniel is the founding member of the Commons Project and a former board chair of the Gavi campaign. He also served as the CEO of Portuguese, a philanthropic grant-making organization and strategic advisory consultancy, where he led a staff of 200 plus in 15 global offices with activities in 90 countries around the world. Previously, he was the executive director of the Elie Wiesel Foundation for Humanity, where he was responsible for the Conference of Nobel Laureates. He is a co-creator of ARBINet, which was the world's largest telecom bandwidth exchange. And last but not least, JP Pollock is with us as well. JP is a co-founder of the Commons Projects Foundation and its chief architect. He is also the co-founder of WellCoin and a senior researcher in residence at Cornell Tech and a visiting fellow at Weill Cornell Medical College. He has designed mobile health applications in domains such as diet and exercise, cancer, and chronic pain. He also developed the photographic effect meter known as PAM by its initials, a digital assessment of emotional states that is used widely in clinical and behavioral research and industry. In industry and as an entrepreneur, he has developed several leading applications in health and life sciences, broadly ranging from genetics to population modeling to health behavior. So clearly we've got a panel that really promises a fantastic and a well-rounded conversation for us all. Stephen, I'm going to start with you first. Please help us grasp the enormity of how COVID has affected the workforce. We all read articles and see statistics of how COVID has upended lives and livelihoods, and how border closures, again, while absolutely necessary in many cases, have exacerbated inequalities. However, we have become, in a sense, almost numb to these numbers. You and your colleagues at ITF, on the other hand, are living this daily through your membership. Share with us what you are seeing, if you don't mind.
Well, thanks, and first, massive pleasure to be on such a panel with such great people. So first, I think probably COVID has brought home quite how fractured our transport infrastructures really are. So we're, as you mentioned, we're a global organisation, and the impact on COVID when it comes to transportation is kind of in many different levels, and I'll break it down sort of sector by sector. But first, I wanted to say, for us, we're gravely worried that the disproportionate impact on women and women transport workers. It's something we've been working on, opening up career opportunities for women, but particularly, and I'll talk a little bit more about it, the impact on aviation and the tourism services that depend on it. And of course, if we look at the fact that at the center of COVID, the first reaction was about sanitation, and many women are in those roles in the global workforce and in precarious roles. So the other area that we've also looked at, and again, there's an International Labour Organization study on this, youth, young workers. We've been targeting, as part of remodeling our campaigning exposure as the ITF, we recognise we need to attract young members into the labour movement. And again, hospitality, gig economy, and frankly, the changing world. And I'll talk a little bit more about gig in a moment. And then overall, depending where you sit in society, but unfortunately in transport as a whole, precarious work has become more and more of the stopgap to fill the spaces, whether you work in urban transport, whether you work in tourism, and those are issues that are the first people to be impacted by COVID. Just briefly to break it down into different sectors, urban transport, I'm not quite sure where everybody is today, but most of us have experienced in our working lives a metropolis, and the actual heartbeat of those cities is the urban transport model. And of course, we've seen many of our bus drivers, unfortunately, before we got to grips with COVID, lost their lives in different parts of the world. Insufficient personal protection equipment, lack of comprehension. Just to mention, the parallel to that, and these are the challenges we need to deal with, is the explosion of home delivery, both for shopping, but also in respect of food. So we saw many businesses transition from their day-to-day lives into home delivery. And again, that gives us a considerable challenge because the gig economy, very unregulated when it comes to employment regulations, very unregulated when it comes to occupational health and safety, all things that we're trying to tackle. Road transport, well, it depends where you sit in the world. Being a truck driver in the world isn't, even pre-COVID, isn't the easiest job to cross borders, but exacerbated massively by sanitation, passport checks, insufficient infrastructure to help truck drivers. That's an issue we worked on. Probably our biggest impacted when it came to loss of jobs, naturally, civil aviation. And you touched on it exactly. When governments shut down their borders to protect their people, again, we acknowledge this needs to be done, but the consequences are not always seen, and the impact, not just on the national economy, but the surrounding economies, and then into regions. You hit civil aviation, you frankly destroy tourism services, and there's an issue there that I hope we'll come on to in a bit more detail. How do we make sure we can open up civil aviation? How can we look at vaccinations and testing and all those challenges that we need to tackle? And then perhaps our kind of best covered horror story is the fact that the world's seafarers tend to be from the global south. When you shut down civil aviation, they can't move. Some of those global south countries have been hit worst, India right now being a prime example, by the worst levels of COVID impact. And at one stage, we had over 200,000 seafarers stuck on ships over and above their contract times, and because of COVID, no ability to get off a ship. So many of them on board more than 11 months, 7 days a week, working every day with no ability to get off a ship. In some cases, dreadfully unable even to get off ships and have medical attention. And I will just say before I wrap up, COVID's impact across the global supply chain kind of depends who you are in the supply chain, depends in which region you sit, but the impact has been massive. And I think hopefully we'll get a chance to talk about what does vaccines mean for us. And frankly, we're seeing quite dramatic inequality between North and South distribution, and those are issues I'd love if we could take some questions on. So I'll stop there. Just a taste, but I know we're tight for time. Thank you.
Thank you, Stephen. And with that, actually, you've hit on a number of points, both on the gender and youth and really the global South. And I would love to pick that point and ask Miriam, as someone who is steeped into public policy, legislative deliberations, as well as civil society advocacy, you have witnessed firsthand the quagmire governments have found themselves in as they try to grasp what Stephen has just described. In South Africa, as in the case of most low and middle income countries, you have another layer on top of it that, given the prevalence of an informal economy that relies on the fluidity of movement of people and goods across borders, not to mention the gender and age dimension that Stephen shared, where women and youth are obviously far more affected than other segments of the population. How do you think governments are actually really thinking through these issues that for all of us outside of that forum, they just seem to be simply impossible to solve?
Thanks, Khadija, and thanks for inviting me to the session. As everyone has said, it's such a wonderful group of people. I'm going to be very short, which is not like me. And I'd like to focus on one thing, which is not how they're thinking about it, but how they should be thinking about it. Because I understand that we've got a lot of public policy people here. And this is going to, what I'd like to say today, I think is true everywhere. And it comes from my experience. I was one of the lead people in the economic recovery plan process. I've been deeply involved in COVID response, from capital raising, macro fiscal strategy, you name it. But I still think that the most important message that one can get across, which has not been taken seriously by private or public sector, has been that my life's work has been about the character of employment. And the emerging character of employment is that most people in the world work in face-to-face services. We could talk about the gig economy, we can talk about manufacturing or all kinds of stuff. But the reality is that most people work in stuff like hospitality, cleaning, security, stuff like that. That's what most people in the world do. And particularly that's important for youth because those are the entry-level jobs, and for women in particular. But generally speaking, that's where the vast majority, like 70, 80% of new jobs over the past 20 or 30 years are created in those kinds of activities. COVID kills that, or the COVID health response specifically kills the activities that are the majority of where jobs are created. We know that. I'm not telling you anything new. Having said that, I'm constantly being asked by our government anyway, what do we do about employment? Well, vaccines are going to help us, and we've got to get them rolled out. But the reality is, in a developing country context, it's going to be some time. And you know how this works. It's about the weakest link. So you may feel that in America or different countries that one is going to be China, one is going to be near fully vaccinated. But the reality is that this is about the weakest link, as we've seen with India as an extreme case, and how quickly one or two people enter, and then you're in your next round. So this is going to be with us for a while. The vaccine story, who knows when we're going to be fully vaccinated. So the very simple preventative measures have to be adopted with tenacity. Now that may sound painfully obvious, but the problem is, I know I live in a very nice neighborhood in Johannesburg. A month ago, as we were maybe coming out of the second wave, which was devastating. I mean, we lost 10% of the National Planning Commission, including the minister who was responsible for leading the national COVID drive. Wow. That's just an example. It was devastating. My neighbor gave her 18-year-old a proper 18th birthday party with dancing, friends, no masks, running around, etc. I went over there. I said, "What's going on?" She basically booted me out. Now, I was amazed that in my neighborhood that was happening, but I know there's a lot of clubbing going on. So in some of the areas, the major shopping centers and so on, it looks like it's okay, but that's not how most people live. So now these things have to be adopted with tenacity. Now, what I've been trying to advocate in the various roles that I've been in so far, maybe not with a lot of success, which is why I'm raising it, is that these very simple, low-cost things, the obvious things that we know about around masks, distancing, disinfection, etc. I mean, we know about those very well. But in workplaces, public and private, in transport routes, in entertainment and hospitality, in the control of events, what I would love to see is industry taking this on as a very, not just setting protocols, but having health and safety inspectors and support, and the public sector that in South Africa actually performs more poorly than the private sector. Yeah, I've been saying we need to start there. Start in your own home, particularly in face-to-face services like health and social services and post office and so on. Now, again, it may sound very, very obvious, but people say, well, we have the protocols, but this behavior is very hard to maintain. So now I raise that as, and of course the digital tracking and reporting and the kind of activity that the Commons Project is involved in. The reason I'm raising it is that I've been raising this point since March 2020 in every major business forum that I've been in, and in every major government forum, which have been many. And I just find that there's a kind of resistance to maybe a concern about policing, which it doesn't need to be. But it's one of the few things that we can wrap our arms around that is low cost, it's within our power to do. And somehow there's this kind of psychological resistance to it, but it's the one thing we could do to prevent a third wave and a fourth wave.
And you're absolutely spot on, Miriam. It is a behavioral issue when it comes to implementation of some very low cost and yet effective policies. So moving from the public sector to a different world, Daniel, as someone who has been in charge of weighing competing demands, both in the private sector and in the world of philanthropic support, what do you think this crisis has really taught us, if anything, about the role of the private sector and private philanthropy, obviously at the ultra high net worth individuals level, about what needs to be done now so that we can avoid a next wave?
I think, first of all, thank you, Khadija, and my esteemed panelists. I really feel that there's a moral imperative for private philanthropy. And whether that's the world's largest and most generous donors to even smaller family foundations, because in many of these cases, private philanthropy sits at the nexus of government, large NGO, and private sector solutions. Many people, many philanthropic organizations have networks of mutual trust and respect. It's how the money was made and is continued to be made by the donors to the foundations. It's the understanding of the systems in which they're working, including government relations. And I believe that private philanthropy can, does, and should continue to play a key role in providing the type of catalytic change that I believe is necessary and almost unparalleled in unlocking and catalyzing the value that's needed in order to bring the benefits to those people on this planet who are suffering most from extreme adversity. Frequently, in my experience, chairing Gavi campaign and others, many of the discussions I've had with friends and colleagues who are running very, very large and significant foundations is, even if we were to commit 100% of our asset base, we're negligible relative to the combined wealth of governments, of sovereign wealth funds and the like. But where I've seen, this is true, but where I've seen tremendous benefit is acting in a catalytic role. And to me, there are sort of two aspects of that catalytic role. It's the sort of more traditional part, which is funding the type of research, funding the type of advocacy, funding the knowledge creation where it doesn't exist. But often more importantly, I find the knowledge exists someplace, but the voice isn't being heard. That knowledge isn't being rapidly incorporated into the systems of the resource allocators and the decision makers globally in a way that would unlock maximum benefit for the most disadvantaged people on the planet. And along that vein, and very much resonating with the comments of my colleague, Dr. Altman, regarding the weakest link, I find that moral imperative for private philanthropy is often to ensure that the voice of that weakest link is not only heard, but appropriately incorporated into the decision-making processes, including the resource allocation. Who are the people suffering most? Who is suffering from extreme adversity? How do we listen to their voice and understand the unintended impacts of the decision-making that's happening and make sure that that's adequately included in the ongoing loop and understanding of the key decision-making? And I think if we always put our decisions at all aspects of these chains, if the philanthropist can work on building and the networks of mutual trust and respect across the multiple sectors, we might be able to ensure that we're really taking a human rights-based approach to all that we do. How do we ensure that things are within the control of the individual? All stakeholders are included.
Yeah, those are really salient points, Daniel, and luckily, and in a way, sadly, because you don't see that the implementation of such kind of logical ways of thinking about decision making, which applies to private, public sectors alike. I would like to turn to JP. JP, hearing Stephen, Daniel, and Miriam speak, technology does not necessarily jump at you as you think of what the world needs to tackle to get out of this crisis, just based on all of the really heart-wrenching stories that we heard from Stephen and Miriam. Yet there is a fundamentally consequential role for health data technology to play. So before we jump into discussing any solutions, I hope you could share with us, in a way, a synopsis of how COVID has, in fact, taken the lid off on how technology in the health sector in particular has never been as passive as we might have been made to believe.
Yeah, sure. Thank you, Khadija, for allowing me to spend some time with these wonderful panelists today. So the question is an interesting one, and from the perspective of technologists, we like to think that technology can solve all problems, but after we've tried to solve any problems with technology, we realize that we can, hopefully make things a little bit better, and at best not make things worse. And the current situation, as you've described, there have been immense gains in the health technology sector, but there's also been immense exposure of many of the problems and significant challenges that we continue to face, in spite of some of the progress that we may have thought that we'd been making over the past many years. Sort of from a fundamental perspective, I think you can categorize 3 important types of health data for the relevance to the pandemic. The first is sort of business-to-business transactional data. These are the typical kinds of data that exist in the healthcare world, right? It's related to billing and prescriptions and describing conditions. And this is by far the most data that exists. The second is public health reporting. So making sure that public health entities have the information that they need to be to take action and measure responses to the pandemic. And last, there's individual-based data. So these are my own test results, my immunization record, my behavioral information, things along those lines. Historically, and not surprisingly, the emphasis has always been on the business-to-business transactions, because that's where the money flows. That's sort of how the system operates. And as a little bit of an afterthought for some, and central focus for others, but definitely sort of a step down from that, is the public health data angle. And then, last is certainly the aspect of individual access and control over information. So during COVID, I would say that all have let us down to varying degrees, but especially as we sort of work bottom up, as I described the priorities, we've seen relative failures there. And the B2B, we've sort of been let down by various kinds of privacy regulations and transactional setups that have made it difficult to transfer health information from entities that have it to those that could make use of it and help us reopen safely, help us understand what's going on with the pandemic. From a public health perspective, we've had a real lack of real-time data. In certain countries, there's very accurate and up-to-date reporting of case numbers and detailed descriptions of how people are responding to lockdown, things like that. In others, these data are nearly non-existent. And last, from an individual perspective, it's become painfully obvious that even getting access to things like our own test results or our own immunization records in a way that we can demonstrate that those are true and accurate has proven to be hugely difficult. And again, is burdening the system and making reopening and travel and the like much more difficult than it necessarily needs to be. Last point, just in terms of progress on the individual data front in particular, because that's where I spend most of my time working. We have seen gains in adoption of standards, in individual access to data, in sort of shifting mindsets to giving people control over their data in ways that are privacy preserving and decentralized over the course of the last 10 months that have outpaced gains that we've made in those domains over the last 10 years. So there is some good happening in the technology sector. There's a lot more to be done, but we are in fact making progress.
That is actually quite remarkable, because to have such a leap forward in a sector that is entrenched in bureaucracy on so many levels, both on the public and the private sector, is really telling what I would like to call opportunities that COVID has presented us, despite the heartache and the hardship that most people have faced with this pandemic. Stephen, I would like to go back to you. In fact, we heard from Miriam and Daniel of ideas around how do you make the system listen better, not how to make it work better, because I think, as Miriam said, sometimes it takes many tries before you get through, but how to make the system listen better. We are quite fortunate today to have amongst us a number of colleagues from various governments and legislative bodies. And so would love to kind of hear from you what you're seeing as emerging effective strategies that could potentially reopen the world again while keeping us all safe, and how you would like to at least see the governments think, and regulators, and how they can help.
Thanks, and Miriam, Daniel, JP, I think there's a couple of points that I'm going to jump around a little bit. So Daniel, I think, as I'm a voice of Labour, we're not against technology, JP. And that collaboration around the issues has been part of what I would describe as a positive coming out of COVID. It really is the sense of humanity about how do you tackle things. But then from a transport perspective, and a message out to all of the audience, many of the transport workers don't get seen as the backbone of our global economies and the global supply chain and all of the parts of the functionality that's been stretched through COVID. So of course, I'm going to bid to kind of recognize the value of trade union rights and human rights as part of the process, and reaffirm, and again, there's places for technology when it comes to occupational health and safety, and frankly, rules without regulation and therefore no inspection tend to fail. So there's lots of conversations here about what we can build on. I think perhaps most frustrating, and I'm going to target the governments, is we've had fantastic hearing from different governments around the world about identifying key transport workers as people over and above all of the restrictions of COVID because they keep the world moving. But when it gets into the public policy space, different departments have more authority than transportation. I think that's for me, the listening point. How do we make sure that we react, and hopefully we don't have to constantly confront such a terrible situation as COVID. But as we build ourselves out of this challenge, we have to hear. A lot of us listen to each other, but we're not always hearing. So for me, the challenges are, how do we work together? What do solutions look like? There are different governments that are working with us. Recognizing, again, I'm going to hammer the vaccination point, that stockpiling vaccination for political merit may get you re-elected, but it won't solve the society's problem. And Miriam hammered it again perfectly. 2 people from India can close Singapore, and that's not because they're Indian. It's because of the variation of the virus. So for us in the ITF, how do you build solutions? How do we make secure movement? I have millions of members who depend on their livelihood because of civil aviation. And on top of that, there's all the urban transport that supports them, the coach drivers, taxi drivers, you name it. They're not moving. And, literally in the last 3 weeks in preparation for this session, we've seen people go back to phase 2 lockdowns because of the Indian variant. So we have to find a global solution, and we have to find ways to distribute the vaccination to the points of most need. We've made a bid to COVAX the transport workers first and civil aviation workers second, need to be out with the national position of priority because they have a responsibility for us all. I think just touching on corporates, it's critical that they play their role. And I think that's both the philanthropic and the technical position, that what yesterday's market, 2019, all the expectations are different now. And we have to build it back in a way that's more resilient. And it isn't always just about cost. It has to be with a bit more of a societal understanding. And I think probably in closing, because I would go on and on and on, apologies, we have to use the technology to help us build those societies where all the stakeholders, wherever you fit, global south, global north, trade unionist, Silicon Valley experts, however we do, we've got to find a space to hear each other and build a policy that we can all come behind. And part of our approach by partnering with Commons Project, particularly on the digital solutions, is to be in a position to keep the world moving and as quickly as possible. But it needs to be a solution for all of us, not parts of our society. Thank you.
Thank you, Stephen. You brought up a very interesting point about the functions of the various entities within governments. And you mentioned the transport ministries, unfortunately, weren't listened to probably as quickly or as decisively as other ministries. And it's quite fascinating to see that, because obviously that probably has happened in lots of places, not just in certain countries, because the system and the policy space, the public policy space, did not, it didn't catch up to the fact that this is a different crisis. And yet transport ministries and border control were really at the forefront of everything. And of course, health is fundamental to all of those decisions. But the triage of the public policy decisions went back to the former kind of modus operandi of how you kind of triage your decision-making based on which ministry is most important without that consideration. And I don't mean to make a general observation that and say that has been everywhere, but that has been a bit of a trend that I personally have seen through interactions with colleagues and policy papers that have been circulating. Daniel, from what Stephen has just shared with us in terms of his view of what needs to be done in a slightly more decisive way, I would like to go back and ask you about your experience as someone who has advised corporates. And actually, Miriam, this is for you as well. From a corporate standpoint, have you seen, if you have been working recently with advising corporations, have you seen a shift in thinking in putting workers ahead of the bottom line, ahead of corporate priorities and shareholders' competing interests? Or are we still in an old world where there is a formula to be followed?
Would you like me to go next, or Miriam?
Either. Why don't you go ahead, since your mic is off?
Right. See, the level, clearly among the most enlightened corporations, the discussion is there. In a subset, I think the discussion is there in terms of the human beings who are these key decision makers, truly being caring people. What I find, however, is many of the models look at the corporations and the regulations around the world that require a prioritization of a CEO or a board towards shareholder return. So as often as I'd like to believe that corporations are the organisms that are protecting and enriching the value to all stakeholders, the shareholder return often dominates. And I feel like this is an area where in the parts of the world where governments play an important legislative and regulatory role in order to level the playing field. I've worked with many corporate CEOs of very large global corporations where I truly believe that she or he as a CEO wants to be on the right side of history, wants to do the right thing. But if the decisions make the company insolvent or on the wrong side of history because their competition is so doing, it takes tremendously more courage in order to continue to do the right thing. And this is why I'm a firm believer of that cooperation, the multi-stakeholder cooperation between NGOs, between listening to all stakeholders, but the need for government regulation. And the last point is, in this with this world of continually increasing globalization, we see what happened just during the period of COVID about our interconnectedness.
Mm-hmm.
But when it's too easy for a corporation that doesn't want to fulfill what I believe are its moral imperatives to all stakeholders, to quickly move to jurisdictions where they're not being encouraged to be on the right side of history, it happens time and time again. And this is where I'm a huge fan of whether it's United Nations-based organizations or others, where the entire world needs to band together. We've learned our lessons, hopefully during COVID, in order to do what's truly best for all stakeholders. Otherwise, the micro motives, often, what I've experienced, often outweigh the macro incentives.
Yeah, and thank you for highlighting the role of the legislative bodies, because it truly does make a huge difference. Miriam, over to you.
Thanks. I would agree with what Daniel was just saying, so I wouldn't repeat that. But I think corporations, they're the idea is that you've got the different capitals and a growing commitment to ESG and so on, and that does seem to be having an impact now. But they respond to incentive structures. And ESG is one of those, in fact. That's one of the reasons why firms are increasingly investing in ESG, because they have to. So as Daniel's saying, some companies are enlightened and work past, our leaders. But the reality is that most will carry on as they are and need to be incentivized and drawn together. Now, in South Africa, drawn towards doing the right thing. In South Africa, it's worth saying that South Africa has been through a very fractious period, and the world is in a very fractious situation as well. So when we say the world's coming together, I don't know, in a way, but the reality is probably not. The world is so fractured. Now in South Africa, we've been through a very bad time. And one of the interesting things about COVID is that the private sector really stepped up as organized business, and particularly in terms of the health response, has been, materially responsible for getting moving and pressurizing and getting the vaccine story moving faster, supporting government in a whole variety of ways, getting hospitals, temporary hospitals set up. It's been a very, very active. It's been a private sector that was feeling kind of despondent and stepped up in this period. And it's been a period when government and the private sector has come together again after a long time, where there hasn't been a lot of trust in it. And I think it's helped that along. I just wanted to come back, if that's okay, also to what Stephen was saying. With all of these sectors, whether it's communities, you're talking about the informal sector, whether you're talking about corporates or you're talking about government, you always have to remember that they have a certain character and they don't just change. Mm-hmm. Now, government, if one wants to influence, and I don't mean this in any bad, negative sort of way, it is a big bureaucracy, and a lot of people forget that. We know that we're annoyed by it, but there are reasons why we're annoyed by that. They're big bureaucracies that are rule bound. It's public money. The risks are enormous. And these are big bureaucracies with certain kinds of decision making. The requirement in COVID requires very fast movement, which is not typical of what governments are good at. Governments are good at things that require routine, like a school system or a health system. They're not good at making fast decisions, and the risks of making a mistake are very high. So I think when we're engaging with government, we just have to be aware. That's how I think anyway, when I'm designing policy. That is what they're facing, and let's just be realistic about that. Could they do it better? Sure. Similarly, businesses have shareholders, and it's not the only stakeholders, but those are central stakeholders. Even when we're talking about communities, one of the things that I don't know that in South Africa we've been very strong at is engaging communities for co-design, so that you get people to do stuff that makes sense for them. You know, the way we locked down at the beginning was great, was okay for a rich area, but it made absolutely no sense if you lived in a shack in an informal area. It was physically impossible to comply. So I think if we can think about the institutional imperatives that decision makers face, including households, and create design that is co-designed and that is sensitive to the realities of whether it's government, whether it's corporates, whether it's, you know, informal settlements, that works for what people can actually align to over a long period of time.
Thank you, Miriam. That's a really, really, actually a number of good points you raised, because as we have been at the Commons Project have been working with various governments to discuss the possibility of how we could be of help in a way as they think through their policies to open borders. It is very clear that when you sit in a place where competing priorities don't just mean that you have a full schedule, they also mean that you're making decisions that are really life or death for many places. And when I say death, I don't just mean health. I also mean the death of livelihoods, which could lead to disastrous consequences for communities. And it is very easy to get impatient and get frustrated when you don't think that the solution is being implemented fast enough. And so that's a really good reminder for all of us, whether it's governments or even the public sector or the NGO, civil society world. I would like to circle back to the idea of health and how even going back to what Stephen said something earlier about the transport workers at, the truck drivers and the bus drivers and folks that we don't necessarily, again, see until we either need them or there's a crisis. And I would like to go back to JP with this question, because it really goes to the heart of the individual, no matter which social spectrum that individual sits in. JP, you have been a pretty strong and a consistent advocate for the individual's right to access their data, but also to do with that data as they see fit. And in various parts of the world, person's health data is really a government ownership in a way, within government ownership. Would love for you to kind of tell us why you feel so passionate about that and why you think it actually matters.
Yeah, another question that I could dig into for hours, but we'll try and limit myself to something short and coherent. So the right to access and control over a person's information in healthcare has been shown to drive better health outcomes in studies for years. But we've really only managed to start to get to the tip of the iceberg in terms of what that access really is. Personally, I've been working in the health tech space and the digital health space for over 20 years now, and for probably 18 of those, I've been beating this drum and promising this digital health revolution that's coming. In this digital health revolution, everybody is going to receive care that's more personalized, It has better access to both clinical information and actual clinicians. The machine learning and AI technologies that are really just now starting to pick up steam are going to be able to provide ways for us to receive care and information that have simply not been possible before. And importantly, this model is imminently scalable to everyone on the planet with smartphones, which today is not everyone, but it's a whole heck of a lot more people than have access directly to top flight medical centers. And those numbers are increasing all the time. So that's been the promise, but we haven't really realized that promise. I'll be the first to admit that no matter how many times I make this promise, we still have lack of evidence that we're actually making a huge difference in the digital health space. We certainly are not, distributing low-cost digital medicine to 7 billion people. We're making progress, but it's going slowly. And the principal reason has been lack of access to information. The information is still locked up in health systems. It's locked up in technology vendor platforms. In some cases, it's locked up by government entities. But either, whichever of those is the challenge, without access to information on your device, it's impossible for these digital and distributed clinical tools to really make a difference for people. In COVID, we've seen this not from a care perspective, but from just the simple need to have access to your information to return to various aspects of your life. People are carrying around paper test results that can be easily forged and are difficult to interpret by people trying to check them. The vaccination records is going to provide a whole wealth of new problems if we don't get ahead of this with solutions that are better than basic pieces of paper. Here at TCP, we've tried to bring a view that control over these data should be in the hands of the person. That is a very good thing, but it also comes with a number of new challenges. Giving people complete choice and control over what they do with their data presupposes that people are going to be able to make good choices that actually benefit them in the long run in terms of who they share those data with, which data should be kept safe and secure, and which are okay to share, things along those lines. We've heard about some asks for a little bit more government oversight. We've heard about challenges presented to technology companies and companies in general by responsibility to shareholders, and all of these are completely relevant in this particular aspect of technology. The model that we're proposing and describing really focuses on individuals controlling their data. And if an individual is controlling their data, it's very hard for other people to monetize those data, which makes the business model a challenge, which makes funding that work a challenge. And those are many of the things that we've been trying to address here at TCP. And hopefully, with time, we'll start to have some good answers for those sorts of questions.
Thank you, JP. And you actually have a question already. We had promised the audience that we will start the Q&A session at 10:45, but unfortunately, it was so wonderful hearing you all. We are now at 10:53, so we might not be able to get too many questions. One that came in from Annette Sturenbergen, who is actually a well-known technologist herself. Annette says, how important do you rate trust? This is for you, JP. How important do you rate trust, and how should we create trust between all stakeholders, including the owner of health data?
Well, so that is a fantastic question. Trust has many different aspects to it. I have looked at trust personally from through a sort of socio-technical and privacy-focused lens. And we've done some formative work at TCP with a couple of our different platforms around what sort of entities people trust to be stewards of their data, to be good holders and sharers of their data. People in the US tend to place much greater trust in health systems and their primary care providers than we might expect. Even as a nonprofit entity and sort of a purveyor of technology that gives people explicit control and access in ways that we don't get to touch their data, we're still a novel entity that is a technology player operating on phones owned by big technology companies, and we have to earn the trust of these individuals. And we have to be very explicit about our actions and who we partner with and the ways in which people are informed about how they're sharing data that engender trust. From my perspective, I think that it's most important that we focus on transparency and education, not sort of education in a broader term, but making sure that when people have access to their information, that they're sharing it downstream with others, that when those entities are receiving the information from people, that they have as much information about the full pathway of those information. It's not just, are the data secure, but how they were received, how they were produced, which parties along the way may or may not have access. From a sort of tech perspective and a platform perspective, that those are the ways that I look at this.
Thank you, JP. Stephen, I want to hear your reaction to JP's points around the importance of the person's access to data, but also their ability or lack of to be able to use it or not use it, depending on the circumstances they're in. How relevant do you think that discussion and that kind of, to your membership, which is large?
So I think at the moment, we do a lot of work in the space we describe as the future of work, which is kind of ironic in that sense, but just by the very culture of the title, technology creates fear and suspicion in people, and in particularly in workers. So the conversation, we see data as part of that conversation. So we're not actually against technology and what that may mean about changing people's jobs. But we do need to kind of manage that transparency question, the authenticity of it, and the control. Probably, back to Miriam's point about government and policy, the free market has too much influence over data at the moment, and people have no appreciation of the value of their own data. And this is an issue that we're trying to communicate to our leaders about, our union leaders. Every time you pick up the phone and you do something, somebody's learning something about you, and there's actually very little restriction on how that's used. So I think we'd come behind JP in the sense that I could give you examples of, and try to be short, but a Filipino seafarer who is a professional officer will have gone through a period of employment qualifications and have data that is certificated of his proof of his education and qualification. At one stage in this COVID period, our seafarers were going to look like the globe's biggest super spreaders, and people were giving them the wrong tests, and there was fraudulent certification. And so, yes, we don't want to undermine civil liberties, but we also have to protect ourselves in understanding that technology can be used and harnessed to help us with these challenges. But we have a bit of a job about educating people that technology shouldn't be feared. And again, we're back to the government space, because it's critical that they give confidence to people, workers, that they will not lose their job because they're being automated. So for us, technology is quite a big space, but definitely we come behind understanding data. Frankly, personal ownership of your own data is critical. And then I can't tell you how many conversations we've had about the challenges if you have to vaccinate. So let's say a seafarer, we want to use one-shot vaccination. Johnson & Johnson's the only one approved in some jurisdictions. The complexity of the right to inject the individual seafarer outside of their national jurisdiction is a lawyer's, it's a lawyer's moment. But for us, if we could work these things out with technology and partnership, we think there's a lot of opportunities to be had.
And with that example that you used, Stephen, how do you take that and then look at it in the context of reopening borders if you're not even allowed to administer vaccine to somebody who's willing, who just happened to be in the wrong jurisdiction? There's a question, sorry, go ahead, Stephen.
No, I think it goes back to the authority of the UN agencies, and it goes back to they've had a bit of a bashing, if we're perfectly honest, and they lack some confidence when it comes in moments of crisis to make those dynamic decisions. So as I say, we've worked immensely well with the different regulatory bodies when it comes to shipping, civil aviation and labour, all under the UN umbrella. But when you need big decisions, sometimes you have to go right to the top. Thanks.
We are on the hour. It's 11 o'clock, but I would love to beg your forgiveness to allow us one more minute, because there is a really good question from Yuri Feliciano, one of our partners in the Aruba government. The question is, do you have any suggestions for smaller governments that are able to make quick decisions? And perhaps Miriam, this might just be going to you.
Well, given that it's Aruba, you know, it's very provocative is the reality. So you're lucky in that regard. And there are countries like the Maldives who are doing some innovative things where they're wanting to open up vaccine tourism once their own population is vaccinated. You know, you come and you get a vaccine and you stay. Great idea. You know, create some competitive advantage for your economy, and especially one that probably relies, I assume Aruba does, on tourism. Maybe I'm wrong, but I think so. So you've got a lot of opportunity there to be innovative, to attract people in that way, if you can. Khadija, you're.
I think I was muted.
On
the point of innovation, it is actually quite striking to see how smaller countries, Aruba being an example of that, have really managed to be creative and to be innovative and kind of be in a leadership role that we have not seen from larger countries in this crisis. So we, it is really, it's really wonderful to see, and a lot of these countries happen to be in the global South anyway. So it's fascinating to see that geopolitical shift as well, in terms of the thinking, the ability to make decisions, but also create space for a new era of decision making at the government level. I want to thank you all so very much. And again, so appreciative of the fact that you all have agreed to do this in the middle of the week and in one of the most probably busiest periods of time for you at work. But thank you all so very much. And we look forward to having you with us again and benefiting from the wisdom of your thoughts and ideas soonest. And